Myoclonic epilepsy with raised red fibers. Rick is a 15-year-old boy who was developing normally, but he started experiencing symptoms that were very similar to myoclonic epilepsy, so he was referred to a neurogenesis clinic by his doctor. Myoclonic epilepsy with raised red fibers is a genetic disease which affects the patient's mitochondria. Its name comes from the appearance of damaged mitochondria, which align themselves to muscle fibers and appear as red fibers when stained and put under a microscope. Mitochondria convert the energy of food molecules into the ATP. This powers most of the cell's functions. The mitochondria in a person with myoclonic epilepsy lacks the ability to create a key protein that is vital to the processing of energy within the cell. This is a very rare disorder. It has an incidence of about 1 in 400,000 people. Myoclonic epilepsy is on chromosome 16. Mutations in the MTK gene are the most common cause of myoclonic epilepsy. They cause more than 80% of all cases, although less frequently. Mutations in the MT-TL1 gene, MT-TH gene, and the MT-TS1 gene have been reported to cause some signs and symptoms of the disease. This disease occurs because of point mutations inherited in a mitochondrial pattern. People with myoclonic epilepsy inherit an altered mitochondrial gene from their mother. This disease presents symptoms that vary greatly from patient to patient, as the number of mitochondria with the defect in a given egg cell varies greatly from patient to patient. It is perfectly possible for some of the mitochondria in the cell to be normal, while others carry the dysfunctional mutation. As a result, the symptoms generally only progress as the patient ages and more of the defective mitochondria are produced. Although mitochondrial diseases are worse when the defective mitochondria are present in the muscles, cerebrum, or nerve cells, because these cells use more energy than the other cells in the body. Thus, they need more ATP to be produced. Symptoms of the disease begin in early childhood, but sometimes don't appear until adolescence or early adulthood. After a period of normal development, the symptoms usually first start to appear. Myoclonus is usually the first symptoms. This is a brief involuntary twitching of a muscle group or a group of muscles. After that, ataxia is the next symptom, which is the loss of the ability to coordinate muscular movement. Followed by this are seizures, muscle weakness, dementia, degeneration of the optic nerve, hearing loss, and altered sensation feelings, which is that pin or needle pain that sometimes people feel. This occurs because of the extensive nerve damage. As you can see in this figure to the left, these are all the parts of the body that would be affected by a patient with myoclonic epilepsy. As you can see, it really affects the whole body in a way or another. There are a variety of ways that you can test for the disease. Clinical testing may include measurement of lactate or pyruvate concentrations in the blood and CSF. CSF protein may be elevated in one with the disease. Brain imaging techniques such as MRI may be used to look for stroke-like lesions, or MERRF is used to look for lactate in the brain. You can also find the disease using electrocardiograms, which diagnose heart rhythm abnormalities, but the most common form is muscle biopsy, which will show the rage red fibers, as you can see often the figure in the bottom right. In the figure on the top right of the screen would be an example of a brain imaging scan. You can see the stroke-like lesions beginning to develop, which is the light colored area. Myoclonic epilepsy with rage red fibers is not deadly, but it is very debilitating and is very hard to treat. Generally, the symptoms of the disease are all that can be treated, such as anti-seizure medications to control the seizures and myoclonus. Physical therapy is also used to gain strength back lost. And there are drug therapies to boost mitochondrial production, but they are of limited and very uncertain effectiveness. They work in some patients, but not in others. This disease is an example of a maternally inherited disorder in which only women can pass on mutations to their children. Although children of both genders can inherit mutations and exhibit the disease, only daughters can in turn pass on the mutations to their children. The pedigree below depicts maternal disease inheritance. And as you can see, an affected father will have no children with the disease, but an affected mother could have 3 children with the disease. In my case study, there was no family history of the disease, which is in line with maternal inheritance. The mother could be a carrier her whole life and never exhibit symptoms, and only her children would be born with the disease. The pedigree to the right is an example of a family with myoclonic epilepsy. As you can see, only the affected girls would pass the disease on to their offspring, and the affected men would not. So Rick's family nobody in the family ever showed symptoms of the disease, but his mother carried the mutated gene, the MTK gene, which resulted in him having it, although he could have children that would not have the disease since he is a man.